We're going ahead and start with the urinary system. We'll start with the male first, and then we'll do the female second. I've removed a couple ribs and part of the pelvis so we can see this a little bit clearer. It starts off with the kidneys. We have two of the kidneys, and they're surrounded by a capsule called the renal capsule. If we go underneath that and go another layer, we can see that we have an outer area of the kidney that we call the cortex, and everything inside that is going to be called the medulla. If we take this area right here, which is the renal sinus, which is the hollow area inside the renal medulla, we can see that it is made up of these passageways. Before we talk about the passageways, let's again talk about some medullary structures. We have pyramids, which we can see, and between the pyramids we have columns, and the columns bring the blood from the renal artery into the renal cortex. At the tip of our pyramids, we have these areas here called the Papillae. See if I can't get one touched right here. That right there. And over here, we can see that the pyramids are going to lead to a passageway called the minor calyxes. The minor calyxes come together and form the major calyxes. And then the major calyxes come together to form the renal pelvis. And then urine then leaves the kidney via the ureter and goes all the way down to the urinary bladder. So that would be the urinary bladder. If we go inside the bladder, I'll try to get a different angle. Here we are. We can see that we have some roughened areas inside there, and there's an opening made up from the areas of the two openings of the ureter and the one opening of the urethra called the trigone. This is this little area at the bottom of the urinary bladder. Since we're talking about a male, again, the urethra is going to pass through three structures in the male. It's going to go through the prostate, and this right here would be called your prostatic urethra. And over here, we actually would have the ejaculatory duct where sperm would come in, but we'll talk about that in the chapter for reproduction. If we go, there's a thin membrane between the prostate and the penile urethra. If we go inside the corpus spongiosum, which is the erectile tissue that surrounds the urethra in the male, if we hide this, we can actually see that this would be the penile urethra right there. And again, the penile urethra is going to go all the way to the tip of the penis, or the glands of the penis, and it's going to exit out a hole called the external urethral orifice. Okay? And that's pretty much it. So we have the penile urethra here. We have the spongy urethra between the prostate and the penile urethra, and then the prostatic urethra here. This is the one of the reasons why males, when they have an enlarged prostate, can have difficulty time starting their stream because of this. Since we are talking about the male, what is interesting to note is if we look at the spermatic cord, we can actually see that the vas deferens arches around the ureter right here, and we can see that the vas deferens goes behind the bladder and joins up what's called the seminal vesicles. But again, we'll go into more detail about this under reproduction. So that there is the male urinary system.